they should be taking and they should not be taking. Some people still keep asking me questions as to whether they can continue their diabetes medications or not, antihypertensives or not, okay, statins or not.
Right.
And there is a lot of doubt and debate going on about antiplatelet agents. Okay,
Yeah.
people partly, I think the government in its release bulletin it said people who are on blood thinners. Okay, so people got confused between blood thinners as in warfarin and aspirin and
Right.
clopidogrel.
They are
So this
confusing between antiplatelets and
exactly,
anticoagulants.
exactly. So that's something. And next question is about, look, we all spoke about all these lifestyle aspects, but people want to manage their diabetes from home. How can they monitor their sugars at the comfort of their own home? Okay, without coming out. Okay, you can speak about glucometer, CGMS systems, online delivery of medicines, online teleconsults. Okay, right. And last but not the least, the much dreaded black fungus. Okay, so what should diabetics be specifically focusing about when it comes to this much dreaded black fungus? Please, can you explain in simple terms? So that's what it is going to be. Depending on how many people turn up, I will divide the questions. So each question, let's not actually make it in a didactic lecturing form. Instead, we'll try to keep it very jovial and an interactive sort of scenario. All right. So each question, I think we can deal for about 3 to 4 minutes. Roughly, there are about 12 questions, 12 fours, 48. And finally, I will ask any take-home message from each one of you, depending on again how many people turn up. Is that okay, Dr. Harpal?
Yeah, perfect, sir. The recording has already started, but we have not started the session yet. But
Okay, perfect.
since so we can start now and let people join in. And
Any other panelists have come?
pardon?
It's okay. Let
Dr.
them keep
Shantaram
joining.
is yeah, Dr. Shantaram has joined. He's just joined. Dr. Venkatraman might be he might not join in, but he might pitch in for a few minutes. So let's see how it goes. But Dr. Shantaram is there already. Hi, sir. Good afternoon.
Good afternoon, Dr. Shantaram.
Okay, maybe he's settling down.
Sambit,
So
we'll start without any
yeah,
further
well, so
delay.
we start. Let me. I'll just start, and then I'll hand over
Yeah,
to you, Dr. Ravi Shankar.
yeah.
So good afternoon, everyone. Thanks for joining us this afternoon. We have with us our leading endocrinologist and diabetologist, Dr. Ravi Shankar from Jubilee Hills, Hyderabad. Dr. Sambit Das from Bhubaneswar. Dr. Shantaram from Grims Road, Chennai. So they will be, talking on today's, which is a hot topic. COVID-19 and also diabetes because it's an epidemic in itself. So, and I will hand over to Dr. Ravi Shankar to take today's proceedings further. And it will be after the session we have doctors will be discussing with themselves, and then you can also raise a question if you have any to the doctors. Dr. Ravi Shankar, all yours.
Thank you, Dr. Harpal. I'm Dr. Ravi Shankar, a senior endocrinologist from Apollo Hospital, Jubilee Hills, Hyderabad. And with us, we do have my good friend and colleague and senior endocrinologist from Bhubaneswar Apollo, Dr. Sambit Das. Soon, Dr. Shantaram will also be joining from Bangalore. That's what I'm told. So the question here is, are we just in the middle of a pandemic, or are we in the midst of a pandemic as well as an epidemic of diabetes? Many people have forgotten that the epidemic of diabetes has started way back, even before the pandemic of COVID, and that unless we do take care of the epidemic of diabetes, it may not be all that easy to get out of the pandemic of COVID successfully with minimal damage. In this context, we do have a lot of challenges when we see our patients in OPD, when our patients contact us through telemedicine facilities, and they ask us a lot of questions. And this is only a tip of the iceberg, because many patients do actually have questions, but unfortunately do not actually resort to reaching out to their healthcare providers. So my first question to Dr. Sambit Das is about diet. We all know that patients with diabetes need to follow a healthy diet. But the question here is, what is a healthy diet? And especially because people are really tense. They really want to boost up their immunity. They want to eat the right foods. They want to make sure that they don't contract COVID. And even if they contract COVID, they want to have a very mild disease and they don't want to be admitted in hospital or die, which is very much understandable. But Can you throw some light about what exactly healthy diet for a diabetic means in the midst of this pandemic of COVID?
Yeah, thank you, Dr. Ravi, and thank you, Dr. Harpal, and the entire Sugar team for this wonderful panel discussion. And as you have asked about the diet, I'll first tell you a joke that just 2 days back, one of my COVID patient who has just recovered, he came to me for insulin adjustment. And the first question was that, Doctor, can you tell me about the COVID diet? So I was actually perplexed. What is that COVID diet? So to all the people over here who are listening, I think there is nothing called COVID diet, or it's just a balanced diet, and a person with diabetes who is taking a proper balanced diet is needed during this pandemic also. It should have a proper balance of macronutrients and also micronutrients. By macronutrients, we tell carbohydrate, protein, and fat that should be in the proper distribution, like 60% of carbohydrate, then 20 to 30% of fat, then 15% of protein, like that. And it should be, it should for it should have good amount of vegetables, fresh green vegetables, the citrus foods, and all that's good for this pandemic also as antioxidants. And I think it should have good amount of protein, and we all know that the protein is around 1 gram per kg body weight. So this how, if they maintain a regular good diet, avoid the fried foods, avoid the irregular food pattern, I think that's what we need during the COVID pandemic for all diabetic patients.
Thank you, Dr. Sambit. In this context, I want to bring up something as well. So people want to build their immunity, irrespective of whether they contracted COVID or not contracted COVID, whether they have diabetes or they don't have diabetes. And everybody is after this magic word immunity, because they think, if they have immunity, they won't contract COVID. And again, even if they contract COVID, they would have a milder disease. Fair enough. And what is this about immune boosters and multivitamins? People are popping up multivitamins and so-called immune boosters as if there is no tomorrow. In fact, just yesterday, it has been published that about 15,000 crores has been spent by Indians in the last 1 year, ever since the pandemic started, on immune boosters and multivitamins. We all know that vitamin D deficiency may not be good in terms of outcomes if you contract COVID. But how much of this is truth that you need to take multivitamins, or should you not be taking multivitamin supplements? Should you be taking so-called immune boosters? Do they really exist? If they exist, how much do you take? How frequently do you take? Should you take it in micrograms, milligrams, grams, kilos? So can you throw some light on this?
I think since last year or when the COVID had started, there was all the myths about immunoboosters and the multivitamins, and everyone has started taking multivitamins, including we also in the first wave. So, but till now, there is no strong evidence of any of these vitamins, say for vitamin A, vitamin C, zinc, selenium, whatever are there, which have been proposed that one should take to boost your immunity, or their immunoboosters. I think there is no sufficient evidences to suggest that, and it's also not clear at what doses that has to be given, except one vitamin which you have rightly touched, that is vitamin D, and if it is deficient, then we must supplement that in the proper doses. And there is one nice study from PGIMR Chandigarh that the vitamin D sufficiency and the vitamin D loading dose were deficient have actually proven the survival benefit and the mortality benefit. So that's the only vitamin which we have some data, but otherwise I think we should not be popping up all the pills what have been prescribed. And you have told that 15,000 is a huge money. I think they could have built some 4 or 5 medical college in that.
Well, the pharma prices are rocketing anyway in the bourses, the stocks. So coming to another question in the same context. So what if somebody takes daily vitamin A or D or vitamin E or vitamin C supplements or zinc supplements? Do they incur any harm? So this is the next question which many people would ask. And so can you throw some light about this?
Yeah, definitely excessive of this micronutrients and vitamins is not good. And we have seen vitamin D, vitamin A, those who are fat soluble, they have a limit actually. You cannot just add to them in your body because they are not excreted in a proper manner. So vitamin D toxicity is not good. And if someone is actually sufficient or his blood level is showing a good vitamin D level, and if you are giving multiple loading doses, and we have seen that in our clinical practice also, that may lead to vitamin D toxicity. So one is to be very sure what vitamins he or she is taking and at what dose he or she is taking, and whether that is prescribed by a doctor or not. Don't take all the vitamins which are available. And I've seen patients in the COVID-19, they've been taking 3 times 4 times vitamins. I am not sure what will happen and what are the consequences in the future.
People seem to forget about the hepatotoxicity or the problems such as nephrocalcinosis that they may have if they were to abuse these vitamins. We all know how much toxicity vitamins in excessive doses can actually cause, but unfortunately, it looks like the general public may not be aware of this. So I think the onus is on us to educate the general population anyway. So moving on from there, from diet and fancy immune boosters to and multivitamins. See, when we speak about immunity, we speak about healthy diet. We also speak about regular exercise, which I will come to in a bit. We also speak about sleeping properly and sleeping on time, because we know that a lot of bad hormones ought to be quietened during our sleep, and the importance of sleep timings as well, apart from the total cumulative sleep time. Can you throw a bit about a bit of light about what happens to bad hormones if you don't sleep on time? What happens to good hormones when you don't sleep on time? And what are the side effects that people can develop and the complications that they can develop, such as obesity, poor glucose control, comfort eating during nighttime? Can you throw a bit about this and how this can impact a diabetic from the sugar perspective, from a perspective of their long-term cardiovascular risk, as in heart disease risk and all that?
I think sleep is very, very important, and a proper and adequate sleep is what is needed, and that should have a proper depth of sleep also, because we know that if sleep is interrupted, then that may lead to some other problems. And all the hormones, fortunately or unfortunately, have all that circadian rhythm throughout the day, and there is definitely it matches with the sleep cycle of the person. So if the sleep is disturbed, it's not in the time, or it is delayed, or it's fragmented, then all these hormones gets actually distorted in their pulsatile secretions. And there are bad hormones, they are actually not bad, they have some other beneficial effects also, but they might be bad for the glycemic control, like corticosteroid, growth hormone, the adrenalines, the sympathetic system, they all get activated or deranged once your sleep is disturbed. And all these things are actually catabolic, or they are counter-regulatory for the blood glucose level. So if your sleep is not proper, then these hormones can go high, and that can lead to increase in the blood glucose level. That has to be clearly remembered. And beside that, if you do not get proper sleep, you have some eating disorders associated with that. You go on snacking at night, and all those things actually will derange your blood glucose in due course of time. So proper and adequate sleep is very, very important to quieten the bad hormones, to so to say, and to control the blood glucose.
Yeah, we all know, for example, on a weekend night, if at all we were to not go to bed on time and watch something on the OTT platforms, we want to eat something and we feel hungry. And again, you want to eat something, and this goes on. So this might apply to a person who may not sleep on time and stay up till night 1 o'clock, 2 o'clock for work reasons or for entertainment reasons, isn't it? Yeah.
Yeah.
So thank you for that answer, Dr. Sambit. Uh, Next, because you mentioned about stress and anxiety earlier when we were chit-chatting prior to this webinar, let me bring it up. People are anxious. Let us accept that. Okay, people really are anxious that their loved ones might contract COVID. Some have unfortunately lost their loved ones. Okay, and there is news all over as well. Okay, some of it might be causing sort of panic situation. There are rumor mongers as well, unfortunately. Okay, and people want to be really up to date by the minute and by the second about what is happening. Okay, they want to watch what is happening in terms of numbers, as if it's a cricket score. Okay, they want to really know what exactly is happening to the number of deaths in Mumbai. They want to know what is happening in Delhi. Right, all this is necessary to a certain extent. But do you think we're overdoing this? Do you think, I think this is causing undue stress? And how does stress actually worsen blood sugars? Because we are more concerned about our diabetic patients, at least in this particular discussion. Can you please say how stress can adversely impact a diabetic's blood sugar control, their weight, and of course, their sleep pattern, which you rightly mentioned earlier? Please, can you throw some light on this?
I think this pandemic has definitely created a lot of mental health problem. I should say people have really landed up in depression, anxiety, the combination of them, and they really need some help. And you have told that the cause of that, because there are so many rumors, and if one watches for 1 hour of any of the news during that April and May, then depression is due in due course of time. So one has to be very careful in that. Mental health is very important in controlling the glycemic control, and beside that, it controls the various hormones also. And the stress level, if it is high, then that increases the counter regulatory hormones like steroids axis, or the corticosteroids, or even the adrenal hormones like sympathetic nervous system, all will be activated, and that will release some hormones that may increase the blood glucose level. So your any stress or any depression can actually increase the blood glucose level or may adversely affect the glycemic control. So stress is very important, and that needs to be addressed, and one has to be positive. Unfortunately, that's not very easy to attain, but one has to be positive in this pandemic.
Yeah, I just advise my friends, or at least the ones who ask me, to just watch authentic news from authentic government portals once a day. That would suffice, isn't it? We
Yeah,
don't have to be updated every hour.
right.
Okay.
But you have
And
a minute updated in WhatsApp and also.
I think we should actually not believe everything and anything that is forwarded in social media, isn't it? I think we should take that with a pinch of salt, or it is better to refrain from that. And you previously mentioned about people getting stressed, developing anxiety. Some even developed OCD. They keep, cleaning their hands every minute, literally. Okay. We all know that we need to maintain hygiene. That we should keep our hands clean, especially if you touch something which might be potentially contaminated. But how frequent should a diabetic wash his or her hands, or apply these alcohol gels and sanitizers? Again, coming to that, studies have shown recently in one small study, um, things have come out that most of the alcohol gels or sanitizers actually do not contain the specified amount of alcohol that can actually kill the virus. So we're doing for the heck of it, it looks like, at least majority of the times.
Right.
So how frequently should we be doing it? Should we be really doing it every minute? Touch something and just pour some alcohol on it? People are developing skin problems as well. People have developed OCD as well. Can you throw some light about,
I think,
because our diabetic patients are really, really careful, at least some of them.
yeah. I think too much use of this sanitizer definitely harm the skin, and in due course, you may land up in some kind of skin disorders later on. We do not know, but the recommendation is that maybe every 1 to 2 hours you can just wash your hands, or with a sanitizer with 70% alcohol, or you can do it in soap water also. And it's not mandatory that even if you are at home you have to wash your hands every 1 hour. So if you are touching something, if you are eating, before eating, after eating, and before, after coming from the toilet and all. So, and if you are touching anything which is suspicious, then you must sanitize your hands.
Thank you, Dr. Sambit. So we touched about diet, we touched about immune boosters, we touched about the importance of sleep. We did discuss about stress and its impact on blood sugar control. Coming to exercise, which is another very important facet of blood sugar control. See, we know that most people have been leading sedentary lifestyles courtesy of COVID. People have been confined to homes. People say that their gyms that they go to have been closed. But I think there is a lot that we can still do within our own homes with whatever amenities that we do have. Can you explain to the audience as to how one can keep physically fit without gaining weight unnecessarily, thus keeping their blood sugars under control? Can you please give some tips as to how one can exercise at home?
Yeah, I think diet and exercise are two important pillars in management of diabetes, and during this COVID time also it applies. But many patients who are coming back to the hospital or they are on teleconsultation, they are frequently telling that our gym and parks are closed, so I am not able to do. I'm taking some mangoes, that's why the sugar is high. So all these things actually come out from them, and those who actually want to do, they do their proper exercise even at home. And I must tell you that whatever things you have at your home, you can do the recommended exercise. So the recommendation of exercise is that 150 minutes of at least a brisk walk or any kind of physical activity per week is okay for any person suffering from diabetes. So what you can do is, if you are not able to walk in the park, at least in your house you can do some walking. You wear a watch. It should not be Apple or a Fitbit, but you can just measure how much time you are walking, and that should be brisk walking inside your home is only sufficient. Beside there, you can do some stretching exercise. You can do push-ups if you have sufficient strength. You can do squatting. You can do the pranayam and all those things. So all these exercises can be done at home. No need for going to gym, or no need to buy big equipments at home. So, but you must be active at home. Otherwise, you are definitely going to gain weight. And keep your food under control, and you take at regular interval as you were taking before COVID, before the lockdown or shutdown, and maintain that proper macronutrient and macronutrient contents.
So now that you mentioned about exercising and the various types of exercises, we advocate our diabetic patients to do a combination of exercises, isn't it? We ask them to do resistance exercises because most people just do aerobic exercises and don't do much of what we call as resistance exercises or weights in simple terms. We all know the importance of resistance exercises in order to control blood glucose. We also have started advocating people to do breathing exercises such as pranayam, as you rightly mentioned. Can you throw a bit of light about each separate form of exercise? For example, types of physical activity that would come as aerobic exercise, types of physical activity that would come under the category of resistance exercises, and what exactly you mean by breathing exercises, and how each might help the individual. I know that there is a bit of overlap between all of these. For example, when you're doing a cross trainer, there is a bit of resistance as well, depending on how much inclination you have and how much resistance that you're applying. And same with your weights. If you're doing light weights more number of times, you're probably doing aerobic as well, along with the resistance. So I know that they do overlap a bit, but can you please give some examples of aerobic exercises for the sake of viewers?
Yeah. So, as you have rightly mentioned, there are mostly these two types of exercises, like aerobic, or commonly we call it as cardio exercises, and there are strength exercises, weight exercises, what we usually call it. And the aerobic exercises, the common aerobic exercises are brisk walking, which you can do at your home also. As I have told you, just wear a watch and do a brisk walking near your house, or
like in your veranda, or in your around your home, in the
right,
garden.
even on the rooftop and all, that you can jolly well do. Second, if you have got treadmill or a cross trainer or a cycle, a static cycle, or that usually goes into the cardio type of exercise or the aerobic exercises. The other kind of strength training exercises are actually the weight exercises or weight training exercises. For that, you may require dumbbells or any of these equipments. But even without your dumbbells, also, if you have 1 liter or 2 liters of bottles, you can do some kind of exercises at home. You don't require
push-ups, pull-ups.
Push-ups, pull-ups are very easy to do without any equipment, so that you can do.
Yeah, people complain that they don't have the equipment or toys to actually exercise, but there's a lot that you can do using your own body weight, isn't it? If you really look at it properly. And breathing exercises, Dr. Sambit, I know it may not directly improve blood glucose control,
right.
Unlike the previous two, which is your aerobic exercises or your treadmill or walking, whatever you call the cardiac exercises, unlike your resistance exercises. But we have been advocating people to do breathing exercises. Yeah. How is it going to help diabetic patients combat COVID?
I think breathing exercises are good in the sense that it actually improves the lung compliance, which if at all you have contracted COVID, it will be beneficial for you. And plus, it is in combination with yoga or the breathing exercises or pranayam can reduce the stress also. And there are papers published on that also. It reduces the stress and it can control your blood glucose. So all these three factors are important and one can do that.
We should perhaps bring to the kind attention of the viewers that anything that is done with discipline brings more discipline to your life and it becomes a habit, isn't it?
Yeah.
You start something for good and you keep doing it, it becomes part of your life, just like brushing your teeth. Some people say, look, dog, yeah, I forgot to do exercise. And how long have you forgotten exercise? For a month or two, or for a year. You don't forget, okay? My immediate thing is, did you actually forget to brush your teeth? No. So if you made brushing your teeth a habit, okay, why not make exercise a habit, a part of your life? And as you rightly mentioned, you can do a lot. Not to underestimate the importance of simple stuff like skipping.
Yeah.
Yeah. Playing with the ball, football, if you got kids around, or even with your friends, if you got a little garden or play area around, any physical activity does help, isn't it, in terms of controlling blood sugars and preventing obesity, and not to forget controlling blood pressure as well in the long run. Your blood pressure might go up slightly during exercise, but in the long run it controls blood pressure as well, because as doctors treating diabetes, we know how much dangerous high blood pressure is, isn't it? And cholesterol. So I think exercise is one of the best things that you can do to yourself in a regular manner without forgetting.
I think during COVID, one positive thing has also happened, that there are so many YouTube and other channels which has opened up with some exercises, tips and all. I think a few of our patients are getting benefited from that. So they can actually watch the YouTube, some of the authentic channels where there would be aerobics and this exercises at home, so they can follow that.
Well, because you mentioned about the good from COVID, or people who changed their lifestyle, there are people who thought, look, we heard that studies did show that diabetics don't fare well if their blood glucose levels are not controlled, and if they contract COVID, their chance of getting admitted in hospital is higher. The chance of ending up on a ventilator is higher if their blood sugar levels are not controlled. And unfortunately, even mortality, death rates are higher in diabetics with poor glucose control. And also in people who are overweight. So people took this seriously. And some of my patients who used to be really obese and not control their sugars, they took this really seriously. They started good dietary plans, started exercising, remembered all the good things that we might have told them long time back. Okay, I'm sure we all do. Okay, but they took this really seriously and they lost their excess weight by regularly exercising. And I was really pleasantly surprised to see them in their clinics somebody who is weighing 90 kilos coming down to 70 kilos, and you think, wow, people have taken the pandemic seriously for good, and they have acted upon it. So I think we need to remind the viewers that they can do it and they should do it in order to improve not just the cosmetic appearance but also their general health outcomes, be it COVID or be it diabetes, blood pressure, heart problems. There's a big list, isn't it? Because we are running short of time, let me move on from there. To when should people start exercising, Dr. Sambit? If somebody, say, develops COVID, okay, they recovered from it fortunately without getting admitted in hospital, and they're doing okay. And the question that they might ask you is, Doc, shall I start exercising now? So what would be your answer for this?
I think my point is that it all depends on what was the severity of their illness actually. If someone has recovered from hospital, from ICU and all, they require some time. We don't want to push them into exercise and fatigue. They can do physiotherapy, they can do stretching, they can just walk for some time till they are feeling comfortable. So these are for sick patients who have improved. For patients who are in home isolation, they have mild COVID, they have recovered, I think they can do all sorts of exercises. But if they are feeling breathless, then they should check their saturation, and if there is really some problem, then they can show to a doctor actually.
Yeah, there has been a study which has been published saying that people really are unable to exercise a lot after COVID. That could be due to lack of muscle mass, lack of strength, general frailty, whatever. So I would suggest anyone who develops COVID to actually take it a bit easy in the initial few 14. They can walk around in the home, no issues, but not to subject themselves to rigorous training or anything like that. And even after their mild COVID settles, to take it one thing at a time, gradually build up, rather than trying to lift and go back to what they used to do 14 days back prior to COVID. For example, somebody like me who's an avid gymmer, if I were to develop COVID, I would say aram se do your treadmill, maybe first day for 10 minutes, not more than that. Okay, that too not with the highest of the speeds, and gradually build up. That's what I would advise, as you mentioned. And for the moderate and severe cases, they really might need proper professional help in the form of physiotherapists, isn't it? Okay. And be wary of your blood glucose readings as well during this process, because if your blood glucose readings are, say, very high, and if you don't take care of yourself, you might get dehydrated and putting yourself to increased risk of clots and such problems. So it's very important to hydrate yourself properly, isn't it? So moving on from that, one important question which we are all posed on a regular basis, Dr. Sambit, about corticosteroids. As specialists who deal with corticosteroid deficiency, excess, and the problems that corticosteroids can cause to even an otherwise healthy human, we are really concerned about the side effects of corticosteroids in terms of increased blood glucose levels, mucormycosis risk, and all that in our patients. Can you tell us as to what a patient, I'm just giving an example, okay? Just imagine a patient who has got diabetes, who is being monitored in home care, okay? He's not admitted in the hospital, and whose HbA1c, the 3-month sugar average, is somewhere around 7.5. It's not too, right, it's not too bad either. And he's on oral medications, okay? Be it metformin, sulfonylureas, SGLT2 inhibitors, and DP4 inhibitors. Let's imagine all four. Okay, this person has been started on corticosteroids. I'm giving an example: dexamethasone 6 milligrams or prednisolone 40 milligrams, because there are no hospital beds. There were, at least, at some point. This person, if really was sick enough to be admitted in, to be given corticosteroids, should have been in the hospital. That's a different scenario. But we've been managing patients who really needed hospital beds as well at home at one point of time because of lack of hospital beds. Okay, and so this person ideally should have been in hospital because he needed corticosteroids. Okay, by definition. But we're managing this person in the home scenario because of lack of hospital And how do you actually manage this patient who is on metformin, sulfonylureas, SGLT2 inhibitors, and DB4 inhibitors? HbA1c is usually just okay, it's not perfect, and you have added corticosteroids. So what should this person do? And does this patient need insulin? Would you stop any medications? Does this patient need to panic? Please, can you explain that?
Yeah, I think corticosteroid is one of the important drug which have been shown to be beneficial in patients with moderate to COVID, and it has to be used. And as you have already told that there was a point, and especially during the May of the second wave, so many patients didn't get bed, and we have to manage those patients on corticosteroid with oral anti-diabetic drugs at home, and we need to control the blood glucose also. And once you have started steroids in that heavy dose, like 6 milligram of dexamethasone or 40 milligram of prednisolone, definitely the sugar is going to be very, very high, and we must control the blood glucose because controlling the blood glucose is shown to be beneficial in COVID. So, as you have already told, that the patient is already on 3 or 4 OADs, and the blood glucose is just under control. And once we have started steroid, it's definitely bound to increase to 300 to 50 or even to 400. So we need to start on insulin, definitely. And we have to tease the patient, and especially on teleconsultation, we must explain that insulin is required and how we can give an insulin. And we usually try to simplify the insulin regimen. We don't give very complex regimen when the patient is at home, and especially those who are insulin naive. Suppose the patient
Yeah.
is on insulin, then definitely we can give a more complex regimen. But an insulin naive patient, we can give simplified insulin regimen, and that we can start at home. And two things are very important. We should not allow the sugars to go around 350 or 400. It should not hover at that point, and they should not have hypoglycemia also. So the doctors if any doctors are there who just want to learn how the corticosteroid is given and how the glycemic control is, then definitely the glycemic control is mostly in the mid-afternoon and in the evening time, and it is usually low in the morning time. So we must get the lunchtime blood glucose more and the evening snack time more, and we should not be pushing the patient into nighttime hypoglycemia. So that's how we manage the insulin regimen. And if we are starting on insulin, then either we can reduce the sulfonylurea dose, and if we are giving a prandial insulin, then we can stop it also. So it all depends on individualization of the therapy and the doctor who is treating.
So, to summarize what you said, individualized patient care. If at all you're unfortunate to have not got a bed and you needed corticosteroids, definitely your treatment regime has to be tinkered. Your oral medications may have to be adjusted, sometimes even stopped, and perhaps you may need insulin as well, is what Dr. Sambit has just said. On top of it, what Dr. Sambit has said is with change in doses of corticosteroids, you may have to adjust the insulin doses. You have to watch for hypoglycemia, i.e. low sugar readings, because if you tend to not eat on time or you tend to eat less, you're at high risk of having low sugars, especially during night time and early mornings, because if you give the corticosteroid early in the morning, which is what it should be, then because the action lasts usually till night time, some last even till the next morning, but some may not last till the next morning, you tend to have a low blood sugar reading if you give a very high dose just that lasts for 24 hours. So, and one important point is people tend to not adjust their medications once their steroids are stopped and tapered, isn't it? We did see some patients, unfortunately, who didn't maintain follow-ups as asked. So, what's your take on that, Dr. Sambit?
Yeah,
So,
I think. Yeah, yeah. Carry on, Dr. Ravi. You
no, no,
wanted.
no, no. I asked you. Yeah, I
So
asked
that's
you.
a very important point you have asked. It's not only important to start corticosteroid, the tapering is also very important. And especially as you have told the case scenarios that the patient is at home isolation, I think one has to be very careful. And the first thing we tell that with when they go for or their relative go for buying an insulin, they should also get a glucometer, and they should understand how to use the glucometer. There are small videos which are available, how to give insulin, how to check the blood glucose. I think we circulate or we supplied that to the patient. And glucometer monitoring is very important. And if the person is like what you have mentioned, multiple oral anti-diabetic drugs on steroids, then definitely we must check the blood glucose at least 2 to 3 times in a day. And once you check, once you have confidence, you can check it 3 times in a day or as and when required. So, and once we start tapering the steroid, and usually the recommendation is that within 10 days we stop the steroid, but sometimes for some indication it is prolonged. So if it is getting tapered, then we reduce the insulin dose by at least 10 to 20% once we are phase-wise tapering that, and we closely monitor the blood glucose. Because remember that high blood glucose is dangerous, but low is still more dangerous, and that has
Both
to
are, yeah.
right.
Yeah, both are equally dangerous, and
Yeah.
low blood sugar can be even more dangerous in the short run, isn't it? Yeah. Um, Glad that you brought up this concept of home monitoring. People are used to going to labs despite glucometers being readily available, despite being very cost effective tools to monitor blood glucose readings at home. We even have continuous glucose monitoring systems which can monitor your capillary, not necessarily your capillary, but interstitial fluid glucose, and giving some sort of idea in real time as to what your blood glucose is. So how do you think people should be using glucometers, especially because they don't want to go to laboratories, which they used to do, just for checking blood glucose? We're not speaking about HbA1c, the 3-month sugar average. We're speaking about just lab glucose. In India, many are used to going to lab and doing fasting post breakfast or fasting post prandial, okay, which is not the convention in many foreign countries. But in India, our people are used to going to lab, getting their fasting and post lunch or post prandial blood glucose readings. So without doing that, how can they comfortably check their blood glucose readings at home? And what sort of targets are we aiming for? I'm not saying you to give a target for every patient, but in general, okay, what are the generalized targets of HbA1c? I know that it has to be individualized depending on the comorbidities. And what are the targets of fasting and um, random blood glucose readings or postprandial blood glucose readings we are looking at in general? Okay.
Yeah. So I think that's a very important point which you have raised, that if a person is COVID-19 on multiple drugs or on insulin and steroid plus or minus, they have to check the blood glucose at home during this 14 days of period of their COVID infection. Glucometer, we check with the capillary blood glucose and check the blood glucose. And if someone is conversant with that, then they can use. We have some recent or the modern things which have come up, like the CGM, the continuous glucose monitoring devices, that might be flask glucose glucometers also, or that might be real time. The flask glucometers are actually Abbott Libre, which is available, and many of our patients are already using. And those who have used once and this flask glucometers or the ambulatory glucose devices, then they should continue during this COVID time if they are on steroids, if they are not very particular about checking the capillary blood glucose. So they can do that, they can transfer that, or just take a snapshot and send it to their doctors, and we know how the fluctuation is, and it's very easier for us to manage the blood glucose at that time. There are some very real-time things like Guardian Connect or this thing, but they are not very popular, or they're not frequently used in our clinical setting. So right now we have the CGM like Abbott Libre Pro, or we may use a glucometer. So these are the two things which can use. Going to lab to check the fasting PP is not actually absolutely required, or it's contraindicated, in fact, during the COVID time, I should say. So you can check your blood glucose, and the target what you have mentioned is that fasting we must keep it between 80 to 130. Postprandial or anything prandial, it should be less than 180, and HbA1c should be less than 7%. But that's the usual target, but it's individualized, whom we should keep at what level. It's the doctors and the patient's discretion or the discussion which brings out the target. But for all practical purpose, if the patient is home isolated on steroids, we try to keep the sugar between 140 to 180. And I'm sure you will also agree that it's very, very difficult to keep it at 140 to 180 once you have started on steroids. But at least we must try that. But no hypoglycemia should be allowed.
So trying to keep it as much as possible within the target range without having low sugar should be the rule of the thumb.
Yeah.
No? Right. So as you have again mentioned about treating a patient at home through remote facilities, through telemedicine, I mean, because we work for the Apollo group, okay, it is pertinent to state what sort of facilities that we do have in terms of treating a patient at home or monitoring a patient at home if they have diabetes or Covet. Can you throw some light about this?
Yeah, I think few good things COVID has taught us is that teleconsultation has become legalized in India, and that's a huge step actually, and it's going to stay for the future. And uh, for all practical purpose, like patients with diabetes, those who cannot come to the hospital and they're afraid to come to hospital, I think they should utilize the teleconsultation. And me both are at the very good setup of Apollo, where we have a 24/7 connect with an Apollo 24/7 app, or we have our own sugar clinic which maintains the appointments, and they give appointments and do teleconsultation or video consultation. I think that should be facilitated more, and that's what we are doing. And by that, we are monitoring the sugars and also getting connected with our patients.
Dr. Sambit, as we're coming to the fag end of our discussion, I would like to ask you a few questions pertaining to the complications of high blood sugar readings. We all know that high blood sugar readings in a diabetic without COVID can cause macro and microvascular complications, i.e., problems related to heart and brain, strokes, etc. If we have to call them as macrovascular, and microvascular complications such as damage to the eyes, retinopathy, neuropathy to the nerves, and nephropathy, damage to the kidneys. This about we do have erectile dysfunction, we do have peripheral vascular disease, that means damage to the blood vessels that supply to the limbs. Foot ulcers, we all know about this. But there are some problems that people can have in the acute scenario when they have COVID. For example, if they're on corticosteroids and if their blood sugar levels are very high, we've seen people developing kidney problems such as AKI. So, and I've seen people drinking ORS, oral rehydration solution, thinking that it's going to give them energy and boost their energy. So, how do you protect their kidneys in such an acute scenario, and what sort of fluids are they supposed to drink? Without increasing their blood sugar levels, without going into dehydration, and making sure that their kidneys are protected. So it's not going to be an easy task. Okay. And what if their blood sugar levels are left like that? And the next question to that would be Mucor. So once you answer this, I'll move on to Mucor.
Yeah, I think the glycemic control is very, very important. And as you have told that long run, we know microvascular, macrovascular. I think all our patients also know that by this time, because they've been repeatedly told in our clinics that it may lead to so many complications. So apart from that, during this COVID-19, if the blood glucose is not getting controlled and it's on steroid, we have seen patients landing up in hyperglycemic, hyperosmolar states, or type 1 diabetic patients landing up in diabetic ketoacidosis. Those are really, really dangerous conditions. They need admission into ICU and proper management. So a good hydration is very important. And as such, any viral infection, say any viral infection, the hydration is very important in part of the patient, and especially for diabetic or people who are suffering from diabetes. So adequate hydration, but you have raised a very important point, that ORS. So many of our patients, even my patients, used to take a lot of ORS. So they will tell doctor, I am taking ORS throughout the day. I told you stop that ORS, or otherwise your blood glucose will go like anything. So ORS is actually a good electrolyte, but also it contains sugar, so it may change your blood glucose. So water is important. If you are adequately taking water, it's okay. So no specific fluids that you should take. It has not been mentioned, but it has to be you have to be adequately hydrated. Your urination should be normal. Don't overhydrate. Also, if you have any cardiac problem, you'll land up in congestive cardiac failure. So you have to maintain a proper diet and good hydration. I'm not taking overhydration. It's good hydration.
So drink to thirst. If your blood sugars are running in 400s, make sure that you replace whatever you're peeing out. Okay, is that okay?
Yeah, perfect.
Yeah, great. So mucor, the so-called dreaded black fungus, as it is called by media these days. So tell me a bit about black fungus. How black is it? How kala is it? How dangerous it is? And why should diabetics be particularly be worried? And why should COVID patients be particularly be worried? What has it got to do with corticosteroids? How can you prevent it? And how to control blood sugar levels efficiently if at all somebody were to have mucormycosis, and how tightly that has to be controlled?
I think black fungus is nothing but, in medical term, it is mucormycosis. It's not a new disease, and it has been there before, and we have seen in our DM curriculum few mucormycosis patients, but they were rare. But the thing which have happened now is a huge patients with mucormycosis because of use of corticosteroid, because of the prolonged use of corticosteroid, because of the high blood glucose, and because of the COVID, and they tell it as a deadly trio actually. And typically that's developing in some of the studies after 3 weeks or 2 to 3 weeks of recovery. Basically, if the blood glucose is not getting controlled during the COVID time, or the blood glucose is not controlled once you are getting steroids, then in long run you may have this opportunistic infection. Mucor is there in many places, or even in our surface, or anywhere in the body also, but it gets invasive once the blood glucose or the immune system goes down. That's COVID diabetes and
So next question is about vaccines. I get a lot of questions about vaccines. Despite all the information that has been provided by the government, by healthcare providers, the common questions I would like to hear from you in the form of answers. First question, can diabetics take COVID vaccine?
100%.
Quick answer, 100%. Good. So should they stop their medications that they use for their diabetes or insulin or cholesterol medications or antiplatelet agents such as aspirin or clopidogrel before, during, or after taking COVID vaccine?
Absolutely not. So they should
So they can continue.
medications. Yeah.
They should and they can continue their use of medications.
Yeah.
What are the absolute contraindications for a person with diabetes when it comes to COVID vaccination? Who all should not be taking COVID vaccination, and if they already have diabetes? Is there anyone?
I think they should take COVID vaccination. There is no absolute contraindication to that, except if they have some allergy or anaphylaxis reaction to any of the components. But that's also
that is very rare, isn't it?
Very rare.
Even yeah.
All practical purpose, I tell all my patients, do not ask me, do not come to me to consult that whether people will tell over the phone, sir, I'm waiting for your appointment to seek advice that whether I should take or not. It's so late. Why are you asking me now? So you continue, you take your shot. Don't wait for your doctor's permission.
Unless they had real anaphylaxis or serious allergic reaction to any of the vaccine components, in which case they can take their doctor's guidance and they can take the vaccine only after their doctor's guidance. Okay. Or if they got very high INR because of any liver problems, or if they're on tablets such as warfarin, which can cause high INR and which can cause a big hematoma, that means blood being released into the muscle and swelling occurring because of the high INR. In which case scenario, again, they need to discuss with their doctor. These are the only two scenarios that I have seen which are really, really a challenge for the vaccinators. But
I think
but
patients are actually confused about blood thinners, and that is to
exactly.
mention that whatever blood thinners or what you tell in layman we give to our patients with diabetes is usually aspirin and antiplatelets and clopidogrel, so they're nothing to do with vaccine. So you can take your shot, you can continue with those drugs. Very rare cases, warfarin and other anticoagulants, if we are giving, then you can consult your doctor.
Because people have confused this with aspirin and clopidogrel initially, and they started asking a lot of questions, and every person who's using aspirin thought, oh look, I shouldn't be taking the vaccine, which is not true. So anybody on vaccine or clopidogrel can take vaccine safely. So that's the message that we want to send out. Then last but not the least question before we try to wind this up would be about new onset diabetes in COVID patients. I will leave that to a little later. One penultimate question: alcohol and smoking. Okay, so people want immunity, people want good health, but they want to have their fag as well. Not everyone, but at least the ones who are used to it. And alcohol. I mean, alcohol, yes, it might have some positive impact on the quality of life who enjoy it, but it does have its share of deleterious effects as well. Can you throw a bit of light about these two, especially pertaining to the diabetic scenario?
Yeah, definitely. Smoking is absolutely contraindicated. You should not smoke, and if you are smoking and if you have landed up in COVID, you are definitely going to have a very bad course or stormy course in due course of time. So stop smoking right now, and this is the time in this pandemic you can take a oath and stop it. And alcohol you must reduce to the minimum, and if you are suffering from COVID, it's better to avoid alcohol during that time.
And a bit later as well, isn't it?
Yeah, yeah.
Till you recuperate, until your liver enzymes are absolutely found to be normal. And even later, I think it's better to actually cut down on alcohol intake. I don't have the numbers, but it looks like people have queued up to the liquor shops after the first wave was over and the lockdown was taken off. People are so
They cut
desperate.
out the
Anyway,
hotspots
I
actually.
mean,
Alcohol
yeah,
shop.
no offense to people who enjoy the alcohol drink, but I think it's better to cut it down as well because it does adversely affect immunity. That's the take home message. Last but not the least question before we wind up, Dr. Sambit. There have been a lot of new onset diabetes cases after people contract COVID. Some have been picked up incidentally during their COVID illness, that they have had diabetes in the past but haven't been picked up in the past. But when they got admitted or when their routine bloods were done, their sugars were found to be high, HbA1cs were found to be high. That's a different scenario. I'm not speaking about that. I'm speaking about people developing diabetes afresh. There are various mechanisms that you and I know that we want others to know from a simple perspective. I don't want to complicate it, but can you explain in simple terms how and why people can develop fresh diabetes after they contract COVID, even if they didn't have diabetes in the past? Please, can you explain that in very simple terms for our viewers?
Yeah, new onset diabetes or COVID induced diabetes is an emerging thing actually, and we are seeing many patients who are diagnosed with diabetes recently after a COVID infection. And the proposed mechanism, what they are telling is that the SARS-CoV-2 virus actually enters the cell through an ACE2 receptor. And this ACE2 receptor is also present not only in the lungs, it's also present in the pancreatic beta cells. And we all know that beta cell secretes insulin. So once it enters into that beta cells, it has also a propensity of destroying that. So that's one of the postulation by which diabetes is produced. Beside that, the SARS-CoV is associated with various cytokine increase, and that can induce insulin resistance, and that may also induce diabetes in due course of time. So these are all the postulation, but this subset of patients who are COVID-induced diabetes or new onset diabetes after COVID is an emerging term, and there is a registry which is collecting the data, and this concept was published recently actually.
So damage to beta cells of pancreas by the COVID virus and other cytokine theories, and not to forget corticosteroids that have been given to the individual, and of course the sedentary lifestyle that a person is imposed to follow when they have COVID. So all these can add up to developing fresh onset diabetes. And thank you very much, Dr. Sambit. That was hopefully an interactive, useful discussion from a viewer's perspective. I should honestly thank Dr. Harpal Singh, who has helped us in terms of organizing this for our viewers on behalf of Apollo Sugar. And apologies if the viewers think that some of their questions haven't been answered in this particular discussion. We tried to cover as much as possible within this past 1 hour. And if there are any further questions, you can forward this to our Apollo Sugar website, and we're more than happy to answer these questions for you. Please do stay safe. Please be positive, not in terms of COVID, but in terms of your attitude towards facing COVID. And please do follow the restrictions and careful precautions that the government has asked us to follow. Make sure that your diabetes is taken care of and that it is controlled. Not to forget, please make sure that we don't pass on any false rumors or spread any negative information, because this has had a lot of deleterious effects on many individuals, and this would not help anyone. On a positive note, I think we will conquer COVID in due course. Be positive.
So thanks, Dr. Ravi Shankar and Dr. Sambit Das. It was a holistic, 360. You answered everything from diet to exercise to, medication to use of insulin, vaccines, sleep, stress, psychological issues, and everything. So I think all the questions have been covered. There was one question in the chat box, which I think already you have answered. The should diabetic patient continue with their medication if infected by COVID? You already answered it, but if you want to put some more light on it, please do that.
I think it's already there. Dr. Sambit has very nicely explained as to how it has to be individualized. Okay. It depends on whether the person is on corticosteroids or not. It depends on what the HbA1c control is. It depends on what sort of medications they have been using, because some of these medications may have to be discontinued. Some of these medications may have to be changed to insulin with appropriate monitoring of blood glucose readings. And of course, this is not written on stone for the rest of the life. This medication has to be adjusted sometimes on a day-to-day basis based on glucometer readings and based on the corticosteroid doses as well. Am I right, Dr. Sambit?
Yeah.
Yeah. So, Dr. Nalini wanted to ask one question, but then we close the session. Dr. Nalini, please go ahead with your question if you have. Dr. Nalini? Dr. Nalini?
Dr. Nalini has somehow managed to be very invisible, or at least she's not seen on the screens. At least maybe she's the one who has done all the hard work.
Yeah, so Dr. Shantaram was also here, by the way, but unfortunately, since you were too engrossed in this, he went for another meeting now. So, but he was there. He messaged me and he said
We
they were.
didn't actually see, as you know, sir was
Yeah.
not seen, so I thought that sir didn't come, and we
Oh, yeah.
went along as
But
a.
I think
Sambit happens to be a good friend as well, so that
okay.
makes it very
So,
casual and easy.
so that's why I think it was very good. Yeah. So Nalini, you are here. You would like go to with your question, please? Yeah. Unmute
Dr.
your,
Nalini,
unmute yourself
namaste,
and
Apollo.
yeah,
Nalini.
yeah. Go ahead.
Uh, Very nice presentation, and both of you had covered so well each and every aspect. What if people has their own query for a normal people also, and those who are medicos also. So I had questions, but already Dr. Sambit has answered all this regarding the vaccination for the diabetic people, because many are having dilemma that I'm on the anticoagulant. Even my father was hesitating while having the vaccination, so I'm an on anticoagulant because many people already they did angioplasty, they are on anticoagulant and having the cardiovascular. So already you had Dr. Sambit and Ravi Shankar sir, you had nicely covered all these things. Thank you for all this. And no question from my side right now. If I have, I will mail. Sure.
So thank you. Yeah, absolutely. I think you, sir, both of you have covered everything, and your friendship. We hope that it goes stronger and build further, and you take it from here. If any question, we'll post it to you. Thank you so much. We will, telecast this on social websites as well. So we'll try and post it over there also, so that people, more users, can just go and see. This was such a informative and session, such a discussion. So with this, thanks to all audience, and thanks both Dr. Ravi Shankar and Dr. Sambit Das. Thanks, Dr. Nalini, as well.
Thank you. Thank you.
So it's a pleasure. Stay safe, everyone.